Blog Talk Radio. Hi, everyone. Welcome to The Wellness Coach on Blog Talk Radio. I'm your host, Edie Summers. The Wellness Coach is your oasis to slow down, tune in, and reboot. Find us on the web at portlandwellnesscoach.com. And we have a really, I think, special and important interview and show today. We're going to be talking about medical marijuana and how it may be able to help you with your medical condition. My very special guest is Dr. Rashna Patel. Dr. Patel, I hope I'm saying your name correctly, and she will be joining us in the studio in just a few moments here. Are you interested in how medical marijuana may enhance your health and well-being or help you with a medical condition? Some of the medical conditions that Dr. Patel has helped people with include, but let's see, let me get back to the show page here. Let me see, sorry about that. I just clicked on a link and it took me down to a whole different show page here. Anxiety, PTSD, difficulty sleeping, sleep apnea, insomnia, migraines, arthritis, rheumatoid arthritis, osteoarthritis, neuropathy, fibromyalgia. I know some of you listening might be coming in from my page, Chronic Fatigue Support on Facebook, and some people have chronic fatigue syndrome or chronic fatigue and also fibromyalgia, so this might be of interest to you. Seizure disorders, hiccups, back pain, sciatica. There's more, degenerative disc disease, spinal, I don't know how to say this correctly, spinal stenosis, inflammatory bowel disease, Crohn's disease, ulcerative colitis, irritable bowel syndrome, and multiple sclerosis. I know that I work with many people in the MS community, and I'm very intimately connected with people both in the chronic fatigue communities and also multiple sclerosis communities on Facebook. So if MS is an issue for you, this show might be really relevant for you. And also poor appetite or nausea or vomiting. So those are just some of the medical conditions that Dr. Patel has helped people with through using medical marijuana. So we're going to be talking today how it might be useful for you. Dr. Patel has been practicing in the area of medical marijuana since 2012. She offers and she helps patients by using a step-by-step process, walking them through how to use medical marijuana for their specific medical condition. And she completed her medical studies at Touro University College of Osteopathic Medicine and her undergraduate studies at Northwestern University. And Dr. Patel will be on the line with us here in just a few moments. I'm just going to make sure that she gets on. She's either coming in, she might be coming in through Skype. And so I'm just going to make sure that she gets on okay. And also, you can also find Dr. Patel. This is her website. It's drrachnapatel.com. So that's www.drrachnapatel.com, drrachnapatel.com. And again, we're going to be talking about how to use medical marijuana for your medical condition. And I'm just going to make sure that Dr. Patel can get on. I think she just wrote to me here. Let me give her another number to call in on. And let's see, I'm going to have her call in on her cell phone. So we'll have her here on the line in just a few moments. And in the meantime, I'm going to head over to her website and give you a little more information on medical marijuana and how it might be useful for you. And let me just send her a message. She'll be on here in the line in just a few minutes. So let's head over to Dr. Patel's website. And let me just type this in. And for any of you who might be wondering about medical marijuana, like I was mentioning, Dr. Patel helps people with many different conditions. Oh, here she is. She's on the line. I'm going to welcome her. And let's get into how medical marijuana might be able to be helpful for you with your medical condition. Hi, Dr. Patel. Is this you on the line here?
Yes, it is. How are you?
Hi. Hi. How are you?
Good. I'm doing well. And how are you?
Oh, good. I'm good. Thank you. And thank you so much for contacting me. I was really happy to hear from you. Dr. Patel contacted me on Facebook through one of my pages, The Wellness Coach, which is kind of linked with this radio show. And I'm so grateful that you reached out to me because I feel like this is such an important topic, and I'm just so happy that you specialize in this. And I think this is really. Yeah, it's my pleasure, and thank you so much for reaching out. And I just think this is a really important topic for people. I mean, there are so many people. I see people that are literally moving out of their state. You know, if they have a child who's sick, and maybe moving to Colorado or something. Just seeking answers. And I know that this is something that you specialize in. You're the medical marijuana expert. And so I was wondering if you could give people an overview maybe of, how is medical marijuana useful? And then maybe we can, I'm happy to talk about whatever you would like to, Dr. Patel, but maybe a suggestion would be breaking it down, maybe some of the specific conditions. I know you also talk about anxiety on your website. I didn't know what you wanted to cover, but I just, this is a huge topic, and I think it'll be really important for people.
Sure. So I can start with the conditions that I most commonly treat in my practice. And those are chronic pain, anxiety, and insomnia. And of course, within the category of chronic pain, the more common conditions that I treat are arthritis, fibromyalgia, back pain, specifically back pain from like degenerative disc disease, sciatica. So those are some of the more common conditions that I treat. And then also within the category of pain, patients who have irritable bowel syndrome. And then outside of those categories, I treat patients who have cancer, especially those that are having side effects from chemotherapy. So there's a wide variety of conditions that I treat.
Okay, that's so great. And I would love to also, I'm sure people are wondering this, and I know that you even address this on your site. So I think people that are interested in medical marijuana are worried about, am I going to get addicted, or I'm not looking to get high, I'm looking for help with my condition. And are you able to address any of those concerns for people?
Yeah, sure. So let's address the concern about not wanting to get high off of marijuana. And that is completely possible. So with marijuana makes a whole bunch of different chemicals, and these chemicals are generally called cannabinoids. Now, the psychoactive compound in marijuana, the one that causes the high, is commonly known as THC. And the scientific name is tetrahydrocannabinol. And so the way plants naturally occur, some of them do make more THC and others of them don't. So if you select a product that's made from a plant that doesn't make more of the THC, then you're reducing the likelihood of getting high off of the marijuana. So that addresses the high. Yeah. Now, the addiction part of it. So I always like to put this in context. There is definitely a potential for addiction to marijuana, but mainly in heavy users. And then the addiction potential is about 9%. And I always like to use the analogy of alcohol. For someone who drinks a glass of wine a day, the likelihood of them getting addicted is small, But if you're having, a case of beer a night, then the likelihood of you getting addicted is high. Now, the way I guide my patients is that I'm focused on lowest effective dose and lowest effective frequency with which you're using the marijuana. So you're basically, when you're keeping the use of the marijuana minimal, you're reducing your likelihood of addiction by a lot.
Wow, interesting. Okay.
Yeah, and essentially what happens is that I found that marijuana can be used as an as-needed medication. So I found that patients, they use it when they need it, and then they don't use it when they don't need it, without having any symptoms of withdrawal necessarily, because they're not heavy users. The other component is, the other component of it is that marijuana is very different from your typical pharmaceutical medications in that it's fat soluble. Okay, so what happens is that, say you did stop taking it all of a sudden, the likelihood of you going to withdrawal, again, it's small because you still have stores of the cannabinoids I mentioned in the fat cells in your body. So it's not like you're going to get that craving like you do with, for instance, opioids. Which are water soluble. So once it's out of your system, it's out of your system, sort of thing.
That is so fascinating. I did not know that, and I also didn't know that opioids, for that matter, were water soluble. And that's, I think, really important to know, because I'm so grateful that you offer this service to people and that it's becoming more available, because opioid addiction is such a huge problem, and people are really suffering, and yet people still have a lot of chronic pain, for instance. So I think it's so great that there are alternatives, and it sounds like medical marijuana is a viable alternative for a lot of people. And I think it sounds like it's really important to work with a practitioner like yourself, so that people, because there are so many different types of ways to take it, right? Like can you maybe address some of that, like the different ways that people, aren't there different types of medical marijuana and like different forms, and would you be able to address some of that for people? Okay.
Yeah. So the biggest misconception is that the main way to use marijuana is by smoking it. And in fact, there's so many different methods other than smoking to use it. And actually, I usually recommend that my patients don't smoke it, because long term there is a likelihood that it will make you more prone to infection, and it can cause inflammation of the lung tissue as well long term.
Okay.
So beyond smoking, you can vaporize bud or what are the flowers on the marijuana plant. So that's one method of an alternative to smoking. You can ingest it. A lot of times it comes in the form of, chocolates, for instance. You can also use what are called tinctures, which are drops that you put under the tongue. And in fact, there are rectal formulations of marijuana. There are vaginal formulations of marijuana. And there's even topicals that you can apply to the affected area, and you can apply it to the skin as well. So topicals are like, ointments, for instance, or salves. So there's a wide variety of ways to use it.
Okay. And so Dr. Patel, I would love to go a little deeper into some of the ways that you just mentioned, like for instance, specifically ingesting, vaporizing, and topically. And then, of course, I would also, after we talk about that, I think for listeners, if we could go a little deeper into some of the specific conditions and maybe some of the different types of specific, I don't know, like maybe the best ways to use medical marijuana for specific conditions. And I'd also love to know, though, a little bit about your background. Just so you know, we have about 15 minutes left live on air for anyone who's listening, and then Dr. Patel and I will probably continue for another 10 minutes. So if you don't catch everything that we're saying live, you can always listen to the replay and hear the entire interview. And so we just really want to offer you help and solutions, for anyone who's looking for help with any type of chronic condition. And specifically, we've been talking a little deeper today about maybe chronic pain and insomnia and anxiety. So this is just really fascinating. So Dr. Patel, so I have some questions just about 3 of the ways that you mentioned taking medical marijuana, ingesting it. So are there any side effects with ingesting? Because I've heard that obviously we have to keep it away from our kids, right? Because there's a danger. Is there any danger with ingesting it, or have they really in like made it. I'm assuming that the technology is getting better in terms of amounts, and I was just wondering if you could address that a little bit. And then I'm also curious also about vaporizing. Is vaporizing safe in terms of the smoke content? Does that lower the smoke content, or I'm not 100% sure how vaporizing works? And then topically, I was just curious about those three methods.
Yeah. Sure. So let's start with the edibles first. Now, edibles are tricky because they do come in the form of food, right? Like cookies and chocolates. So a lot of people make the mistake, like, oh, I see a cookie. I typically have, a cookie, right, out of the jar. So I'm going to have the whole cookie. And so that's the mistake that people commonly make. They consume too much. And so because you're consuming too large of a dose, you're bound to have side effects from it, right? So the goal with edibles is that you want to you basically you have to consume a whole heck of a lot less than you typically consume of a regular cookie, okay? Because you have to realize that it is medicated with marijuana. And the other thing that people don't realize is that with marijuana, a little can go a long way.
So good to know. That's a good point.
Yeah, and a lot of times now, here's the thing. The problem is that, again, there's not a lot of research behind marijuana, so there isn't really much in the way of standard dosing that's available, and, information. But they do put dosing suggestions on the packaging. And the thing I warn patients about is that typically I find that what they put on the packaging is too high of a dose. So I would go way less than what's packaging. So that the main side effects are tricky for that reason, is because a lot of people, you see like a chocolate bar and you want to have like, I don't know, something that tastes good, so you have the whole bar. Yeah. But that's the thing you don't want.
You want to be careful.
Now,
okay.
Yeah, so let's talk about vaporization. So that is a method. Vaporization essentially is a method where there are devices out there called vaporizers, and you heat whatever's in it rather than burning it.
I see.
Yeah, so I like to equate it to using a diffuser, for instance, with essential oils.
I like that.
So you are inhaling it, but when you're inhaling, what you're not inhaling are hydrocarbons that are created when you're smoking something, when you're burning something. So that's sort of the advantage. So overall, in general, vaporization is better than smoking, is what I found. Now, there's a lot of different vaporizers on the market, so there's nuances to it.
I was wondering about that. Yeah.
Yeah, overall, this is what I found. And then,
and sorry, Dr. Patel, really quickly, before we talk about the topical, with vaporizers. So you have a medical practice where is it in California? Do you want to talk a little bit about that in terms of, because the vaporizers, do you have vaporizers there as well as the medical marijuana, like where you can help people figure out which one is best for them to take and something like that? I was just curious about, because I think that's, it sounds, before we talk about the topical. Go ahead.
Here's the thing I want to clarify. So I, as a physician, cannot dispense any marijuana products.
Good to know. I see.
Yeah.
Okay. Very interesting.
So it's basically like you're going to a physician for a prescription, and then you go to pharmacy to pick up that medication. So
I see. Okay. Interesting.
Yeah.
Got it.
But I do guide, so basically what I do is I guide my patients on, they have this particular medical condition. What's the best way for me to use the marijuana? So I walk through, what combination of chemicals will work best for them, how they should be using it, what methods work the best, how often they should be using it. And then I go through, how to avoid side effects, what to do if you have side effects. We're also discussing a lot of commonly asked questions that they have as well during the consultation.
Oh, that's perfect. That's perfect. So that answers my question. And then, so we'll circle back to that. So let's talk about topically, and then maybe we can talk about some of the conditions on a deeper level, because it sounds like there are different properties in marijuana that you prescribe based on what people have, right? Like, isn't that how it works? Like, some work better for pain, and great. So then, I was just curious about, so is topically more effective, say, for like pain or inflammation, something like that?
Depends on the type of pain. So, for instance, arthritis, I found topicals to be very effective for that condition.
Wow.
Yeah. So also, topicals work well for certain skin conditions, like psoriasis, for instance.
Wow. Very interesting.
Yes. Yeah, it helps to reduce the inflammation that's going on. It also works well for any sort of muscle spasms that you have as well. Certain conditions, the topicals work really well for. But, like I mentioned.
Okay. Very interesting. And then, let's talk, and then there are so many questions I could ask you, but I'm sure that would be really helpful for people is to hear a little bit more about like specific conditions. So maybe we can choose, or maybe you can choose a couple, and we can just go a little bit deeper with them, just to help people, whatever you think is most relevant, or maybe is some of the most frequent reasons that people come to see you. Maybe those conditions. Maybe just like one or two of them.
Yeah. Do you have specific questions about the condition?
Well, I was just curious. Like, let's just take maybe chronic pain and anxiety, and let's take all three that you mentioned. Like, I think the three top that you mentioned, was it insomnia, chronic pain, and anxiety? Like, what specifically do you recommend for each of the, like, in terms of medical marijuana for each of those three conditions? Unless that's too much to bite off.
It varies by condition, right? Even within the category.
It varies by condition.
Yeah, it varies by condition. So those are pretty. Chronic pain, especially, is a very general condition. But let's just take like multiple sclerosis, for instance. Okay.
Yes,
so multiple sclerosis.
Perfect.
One of the most common symptoms of that is spasticity. Okay, that's where your muscles start to cramp up, and that, as you can imagine, causes a lot of pain for patients. So in that particular case, the chemical CBD. Okay, it has very potent antispasmodic properties. Okay, so essentially it's acting like a muscle relaxant, like a prescription medication, baclofen, for instance, which is commonly prescribed for multiple sclerosis. So that's what I generally guide my patients towards is you want to use something that's higher in CBD so that it can help to relax your muscles, for instance.
That's perfect. That's exactly what I was looking for. And then, Dr. Patel, I'd love to talk maybe about a few more very specific conditions, maybe like, let's say, fibromyalgia, because I know there are a lot of people in my community that also have that. But I was wondering, can you work with people online? Do people have to come see you in your office, or can you also work with them and prescribe to them online? I'm just curious about that. Or does it have to be specifically for California?
Well, here's the thing. So I do consultations for informational, like, and educational purposes. And in that case, people don't have to be in the state of California. But in order to issue a recommendation, they do have to be in the state of California.
They do have to be in the state of California. Okay, good to know.
And I do.
And that's just because of the laws.
Yes, that's because of the laws. So I can't issue a recommendation. A medical marijuana recommendation outside of the state of California. Typically, the physician has to be licensed in that particular state. The other thing is that the laws vary from state to state as well when it comes to these recommendations. I know California is fairly lax when it comes to it. Well, basically, it gives the physician a lot of freedom in determining, which patient will benefit from the use of medical marijuana and which patient won't. Other states are very, they have a stringent list of conditions that doctors can only recommend medical marijuana for these conditions. Now, how they come up with those list of conditions, I'm not certain. But so, yeah, it does vary from state to state. So, and I'm always putting out, information on my website as well as much as I can, because I know there's a need for this information even outside of the state of California.
Absolutely, yeah, and thank you for doing that. But you also said that you can do consultations online just to help people like find more information and get more oriented with medical marijuana in general. Is that that's fantastic.
Typically, here's the thing: the information is best suited for for people that are located in states where marijuana is either medically or recreationally available. Because a lot of what I educate them on is laboratory testing, which is typically implemented in states where it's available medically and recreationally. If it's not available in either of the situations, then the information that I provide won't be of benefit because really you're not knowing what most likely I'm imagining in those scenarios you're just getting it off the street, which I don't recommend.
Oh, yeah, not good. Not good, right?
No, not good. And for a couple of reasons. So let me walk through that.
That's a great point. Thank you for bringing that up. Yeah, it's a great point.
Yeah. So one is that marijuana is very prone to growing fungus. And so you want to make sure that whatever you purchase has been tested for fungus and bacteria. And this is especially important in patients with compromised immune systems. So this is not just like HIV cancer patients.
Great point.
But these are also patients that are taking drugs that are immunosuppressive. Okay, so for instance, someone who is on methotrexate, that's an immunosuppressive drug. It's commonly prescribed for patients who have severe arthritis. So even in those situations, you want to be careful. You don't want to get sick from it, right? The other reason is that, how is this plant grown? What are the levels of pesticides and fungicides that are used to grow these plants? It kind of defeats the purpose in using marijuana if you're using something that has toxic levels of pesticides and fungicides.
Yeah, that's another great point. I didn't. I never thought of any of that. That's crucial for people with compromised immune systems.
Even in the state of California where it's medically legal, again, it's not a fully regulated industry, right? So a lot, even in Colorado, where they're starting to implement regulations. In fact, CNN did an undercover investigation in Colorado, and they did in fact find toxic levels of pesticides. Okay, so that's important. You don't want to harm yourself. You're aiming to use something natural, but in the process, make sure you're not harming yourself.
But still therapeutically, you still want to. Right. I think. I didn't mean to interrupt you. That's that is such a crucial point. Yeah. I just get really passionate about this. Like you want to do this therapeutically, which takes information and guidance, and it has to be methodical. Like you want to know. Yeah. What you're taking, and I think it's very important when you're dealing with your health and well-being, and especially if you have some type of medical condition.
Yeah.
So, fantastic point, Dr. Patel. Yeah.
And
Dr. Go ahead. Go ahead. Yes. No, go ahead.
The third thing is that a lot of times marijuana on the streets can be laced with other substances like PCP, for instance, or ketamine.
Oh my gosh.
Right? So
wow.
So that you may completely be unaware of. So buying it off the street can be fairly dangerous. So that's something to
really
be careful
important
about.
Point. Yeah, definitely.
So,
wow, thank you so much I had no idea, and I didn't even think to ask you that, so I so appreciate you bringing up those points. And Dr. Patel, we have about a little over a minute on air, and then we have about 10 minutes afterwards. But for anyone listening live, if you could please let people know how to specifically contact you, that would be great, so people can either get a prescription from you or get consultation from you, or both.
Sure. So they can just visit my website, which is www.doctor, which is just Dr. Rachna, RACHN as in Nancy, PATEL.com. So that's drrachnapatel.com. And there's my contact information is on there, and you'll probably reach my receptionist, so you can
perfect.
Leave a message.
Okay, perfect. Thank you for sharing that. And then, so for anyone listening live, we're about to go off the air live, and like I said, you can, if you want to hear the end of this podcast, or you want to listen back because there was a lot of information that we're sharing in here, definitely listen back to it, and you can hear also the last 10 minutes. Dr. Patel and I are going to continue just a little bit longer here, and let's talk about fibromyalgia. And then I would love to hear just a little bit about your personal background and how you got interested and you specialize in medical marijuana.
Sure.
And thanks for listening, everyone. Thanks for listening. Go ahead.
Yeah, thank you. And so let's talk about fibromyalgia. Fibromyalgia is definitely just with my experience in conventional medicine, what I found is that a lot of times doctors tend to be dismissive of it, and I think it's
very true.
It's difficult to find a solution for it. The pain is just it's so intractable. And so
so true.
Medical marijuana I found does help patients. What I found is that what surprised me the most with medical marijuana and fibromyalgia patients is that usually they're on a cocktail of medications. And what I found, this is really surprising to me because my assumption was that probably what will happen is that these patients will add medical marijuana as part of their arsenal for pain management. But instead, what happened was that when I follow up with these patients, they would tell me, Dr. Patel, I have significantly reduced the dose of the medication, the doses of the medications that I'm on.
So great.
Or they've been able to significantly eliminate many of the medications that they're on. So
that's amazing.
Is great. Yeah, and then the other thing is that they're not having, and I usually also discourage my patients from overusing marijuana in terms of frequency. So, and that, I walk them through, how not to overuse it. But what I found with fibromyalgia patients is that for the most part, they can use the marijuana on an as-needed basis, and that suffices to help with managing their pain.
That is really great news to hear. And I mean, it sounds like, I know you said there's not a lot of research yet, right? However, obviously, practitioners are getting results, and I know that it's really helping people with seizures, like kids with seizures, and there are all sorts of ways that people are really benefiting, and I think this is, from medical marijuana, and this is so important. And Dr. Patel, I know we didn't talk about this before, but have you ever worked with patients? A lot of the people that are in my community on Facebook are not only dealing with chronic pain, but the other big issue is chronic fatigue. And also, of course, there's anxiety and insomnia like you were talking about. I think these are all really huge, but have you noticed patients doing better in terms of chronic fatigue? Because I just remembered to ask you this since I know so many people that suffer with that as well. Do you have any advice for them?
Yeah, chronic fatigue specifically, I haven't found the medical marijuana to work one way or the other. More specifically, it doesn't make it worse, but I haven't found that it makes it better. Now, typically, though, chronic fatigue a lot of times it comes in conjunction with other conditions of pain, right? So of chronic pain, so like fibromyalgia, for instance. A lot of patients that have fibromyalgia have chronic fatigue syndrome as well. And so by improving the pain, it does help to improve their energy levels. They're able to, at one point, with the pain, they're not able to kind of go about doing their activities of daily living. When the pain is, better managed, they are able to do their activities of daily living, like exercise, for instance. And then that in and of itself helps to manage the fatigue that they're having better.
Very interesting. And I mean, I can only assume that chronic pain is very stressful on the body, and so maybe by relieving some of that might relieve some of the chronic fatigue. And well, that's interesting. I wonder about, so we have a few minutes left here. What about for like anxiety and insomnia? Do you have is there anything else you could say about that for people that are listening, since we kind of touched upon that in the beginning in terms of like how you help people with that?
Questions?
Is there a certain type of medical marijuana that you recommend for, let's say, generalized anxiety, or just, and insomnia too? Okay.
Yeah, so one of the things that I always tell patients with anxiety is that you want to be careful because if you use the wrong type of marijuana, and this is typically marijuana that's high in THC, it will lead to worsened anxiety to the point where you're having paranoia. So
high in THC.
Anxiety. Yeah. Now, the other thing is that with insomnia, it really varies. I treat my patients that have mild to moderate insomnia very differently from patients that have moderate to severe. So it really
I
sort of
see.
depends.
Okay. I see. Okay. That's good to know. That alone is good to know. Okay.
Yeah. Yeah.
That's yeah. I mean, it's
some general pointers about anxiety.
Yeah, no, that's perfect. That's perfect for anxiety and insomnia. And then just really quickly with chronic fatigue, I've read that, and I don't know if this is within your expertise or not, but like in terms of there are different types of marijuana, like is it sativa and indica? I've heard, I can't remember which one it is, but one is that's more of like the mental type of marijuana. I don't I'm not an expert on this, but there's one that's supposed to help more with energy, but I didn't know if you have you heard of this or run across it, that one's more for sleeping and one's more for like mental energy. I'm wondering if that would help also with maybe physical energy. Just
so these
in your opinion.
But I'm not a big fan of, mainly because they're too
broad.
broad.
Interesting, really. They're too interesting. I didn't know that. Okay.
So let me just define them for you in terms of what they actually mean. So basically they're terms referring to different types of marijuana plants, okay? Now, here's the thing. When it comes to the definition of these terms, they vary. If you look at, let's see, I think it's called the American Journal of Botany, they define sativas as making more CBD, okay? And
CBD,
and as making more THC. But then if you go to a medical marijuana dispensary, they will tell you the opposite. They'll say sativas generally have more THC and indicas generally have more CBD. So commonly what they'll tell you at a dispensary is that sativas cause more of a head high, indicas cause more of a body high. And for me, this is completely, and my patients, it's completely useless because guess what? None of my patients are looking to get high off of marijuana. And there's two broad, okay? Really what you want to hone in on are the exact amounts of the CBD, the THC, and some of the other cannabinoids that are in there. So these are terms that I'm not a fan of, and I think they take root more in recreational use rather than medical use. So these
very interesting.
When you're going to buy.
It's really interesting. I didn't know that. There's so much to learn. Like I said, I so appreciate you coming on because there is so much to learn, and I really feel like we're just at the tip of the iceberg on how, medical marijuana can really help people, I think, and so it's really exciting, and I just can't thank you enough for being here. And we have just a few minutes left. Since we're not technically on the air, it's hard to say when Blog Talk Radio will, in a very benign way, sort of end this interview. But we have a few minutes, most likely, and so I didn't know if you wanted to share just really quickly, like the reason that you got into this, like what's your motivation and the reason that you're so passionate about this. Okay.
So let's see. I happened to be surfing Craigslist one night. And I happened on an ad that said medical marijuana doctor needed. And it was out at a clinic in California. Okay, so I definitely piqued my curiosity. I started looking into the field. And then I started looking into the research. Now, at the same time, my background is in emergency medicine. And there were a couple of points that stood out in my mind as well. So one of the things was that there was a 10-year-old boy who had come in, and he was barely breathing. Okay, he wasn't. He was. You couldn't arouse him at all. We were ready to send him out, fly him out to the closest, like trauma center that could take care of children. And before we did, somebody decided to get a drug screen on him. And what we found in his drug screen was that it was positive for opioids. And so we were able to, fortunately, we had enough time to give him a reversal agent. And when he awoke, we asked him, we were like, what happened? Why were there opioids in your system? And he said that he had his dad's OxyContin. Okay. Now, where the prescription for OxyContin obviously came from a physician somewhere. Okay. The other thing is that another turning point was another patient that I had encountered in the emergency room. It was about 4:00 in the morning. And she had, she's one of those patients that, ER doctors like to label as drug seekers. She wasn't, we weren't sure if the pain, the level of pain really required this sort of, 4 in the morning visit to the emergency room. So when I looked at her records, she had twice before overdosed on opioids. And in both instances, the doctors, she ended up in the ICU. In both instances, the doctors had predicted that there's a 90% chance that she'll probably die. But she was fortunate, and in both instances, she was able to survive. But yet, here she was again in the emergency room seeking drugs. Right? Seeking opioids. So I actually got into a little bit of a conflict with my attending physician because I did not want her to leave the emergency room with a prescription for opioids. And my attending physician said...
Understandably so, yeah.
But my attending physician said, look, Patel, what's probably, what I don't want on my hands is that if she goes out and she withdraws, and you could potentially die from, a withdrawal syndrome.
Right. Okay.
Then I don't want to have
catch-22.
that I don't want to have that on my license.
Jeez.
So that was a situation.
Oh my gosh.
Right? Yeah.
Wow.
And then the other thing was that I had to do when you're training, you're doing. I had to do a toxicology rotation. So essentially, what this rotation is that you're dealing with patients that have overdosed, mainly on prescription medications. Okay.
Oh my gosh.
So there's an entire unit at a hospital that's devoted to overdoses on prescription medication, right? So
wow, I didn't know that.
When you start off medical school, you're not intending to you're really trying to help people, but instead, you try to when you encounter these situations, you sort of step back and you're like, am I playing some sort of part in causing harm to people?
Wow,
that was
fascinating.
Big, it's almost like you carry guilt with you, because
oh my gosh,
a lot of these addictions are starting as were supposedly benign prescription medications, but then these are highly addictive substances, and they're spiraling into overdoses. So,
oh my gosh.
So that was encountering those situations was a pretty big kind of sat at the back of my mind quite a bit. So in any case, while I was doing the research for marijuana, one of the things that really stood out to me was the potential that it had for pain management. And it's low potential for killing a patient. So what I saw
very good. Yeah. Perfect.
Was that it has the potential to treat chronic pain well, better than these other medications that have a higher potential for harm in patients. What I did was about a year later, after having gone through the research and everything, you need clinical experience. Now, at that point in time, and even now, there isn't really any formal training in the area of medical marijuana. So what I did was I signed up to work at a medical marijuana clinic in California, and I spent a good year doing that, and I gained tons of experience, just talking to patients that were using medical marijuana for a whole bunch of different conditions. Now, the drawback of that situation was that the industry the medical marijuana industry kind of has shady roots, because a lot of these clinics were opened up just as mills that were handing out cards, and so I didn't really feel like I was doing my work with integrity. So that's when I opened up.
Important.
Once I earned enough capital, I opened up my own practice, and that's when I was, sitting down, walking patients through. Okay, this is how you want to use it, so you don't get side effects. You only get the benefits from it. And here I am today.
That's amazing. Wow. What an amazing story, and I just thank you so much for being a pioneer. And I would love to have you back. And unfortunately, we're running out of time, and I don't want us to be cut off just out of the blue. So, but I would just want to remind people of your website, and I can't thank you enough for being here. And I hope I know this is going to be helpful for people. So again, Dr. Patel's website is drrashnapatel.com, and you can also check it out on the show page. And Dr. Patel, I'm going to have to, let's close so we don't get cut off here, because it's about to end, I believe, on its own. But I can't thank you enough for being here, and I hope that you come back, and thank you so much. This is invaluable information.
Yeah, thank you for having me on your show. I appreciate it.
Thank you so much, and you're welcome back anytime. And let's continue the conversation. And I can't thank you enough. And everyone, thank you so much for listening. You've been listening to The Wellness Coach on Blog Talk Radio. And come back and listen to more episodes. And we hope you have a great day. Take care. Bye-bye.